Alright, so the types of trachs are fenestrated. This is a non-fenestrated trach. A fenestrated one would have a hole here, so it would help with phonation when the patient's talking on the passing-muir valve. One of the type of trachs, which I obviously don't have a picture of or an example of, is the Jackson trach. It's a metal trach, and here in the Tampa Bay area, most of the Jackson metal trachs used to be used by the VA. It's metal with an inner cannula, and it's not for ventilation. So one of the struggles or challenges you may have as a respiratory therapist when a VA patient comes into your hospital and they have the Jackson, should they have a ABG result that requires ventilation, you have to change the trach before you'll put them on a ventilator. The Barona trach, once again, is also called the Cayman-Wilkerson. It's a foam trach, and the pilot balloon is open to atmospheric air. It doesn't have an inner cannula, and there's really not a pilot balloon to go to. The PMV, passing-muir valve, that allows the patient to speak, and the way that works is it's a one-way diaphragm. You'll put it, let's see here. Okay, this is the hub, and you put a one-way valve right on here. So when the patient breathes in, the diaphragm will move in, allowing air in. But when they breathe out, the air will come up and it'll slam close the diaphragm against the inside of the PMV, and it'll force the air up to the vocal cords, allowing the patient to breathe and to speak and to phonate. The nice thing about that is speaking, once again, is a big morale boost to the patient. It was created and designed by a patient that was an engineer, and he got tired of not being able to communicate with his nurses and respiratory therapists and doctors. So he designed it, and it's used around the world now. There's two types. There's actually one, it's purple, it has a little adapter to it. You can actually put oxygen through there if you had to. Most of us don't use it that way. It comes in a green cup, and it's green for the Tampa Bay area. Most of the hospitals use that one. And the whole key to it is this. Your pilot balloon needs to be deflated, and we usually put a little green tag around here to remind everybody of that. If you don't deflate the cuff, you'll pretty much be suffocating your patient. They won't be able to breathe. And the way you'll know is they'll quickly desat. And your nurse will call you in the room, and you either the first thing to do is take the valve off so they can ventilate, and then make sure the cuff is in the proper position, if the patient will let you put it back on. Usually what happens when the patient starts to feel suffocation and shortness of breath, since they've been through so much already by this time, most of them will not let you put it right back on. Okay, but if they do, just make sure it's deflated and reassure your patient. Okay? Let's see. That concludes everything in this presentation. Thank you for your time, and I hope you have a nice day or evening. Take care. Goodbye.